following the addition, under committee items, we have an additional report. I would request that it be placed as 4G, the report from Zoe Lyons, the County DHS Director. All right, so Carrie, do you have that? Awesome, thank you. So we have a motion and we have support of the amended agenda. All in favor say aye.
Aye.
Opposed? All right. Following the agenda item, we have public comment. Is there any public that would like to make up to 5-minute comments? Public comment? Seeing none, we'll move on to committee items. The first item under committee, the committee portion of the agenda, letter A, the minutes of the May 12th meeting.
Move to approve. Support.
We have a motion and support to accept the minutes. Are there any additions, corrections to them? Seeing none, all in favor to accepting those minutes as printed, say aye.
Aye.
Opposed? Passed unanimously. Health Department, monthly report.
Good morning. I'm not Richard, as you can see, but I am here to support the report that he provided to all of you. And basically, I'm here to answer any questions. I'm guessing that you had the opportunity to read the full report. I am well briefed on the areas as well. If anybody has any questions, I could just add, just as a matter of business here, that I know there was concern about the Express Care closure, and what Richard has found in a follow-up with his co-workers at Allegiance Health, two things: that we now have extended health care hours for patients of Allegiance Health practitioners, in that the office on North Street, where Dr. Adam Tech and Burgess reside, they have extended hours there Monday through Friday from 5 until 9. Now this is for Allegiance Health provider patients. Also Saturday morning hours from 8 until 12. We do know that clients with Medicaid or who are uninsured community members can go to the urgent care centers that we do have in town. However, we did find out that Med Plus, which are two, there's one in Brooklyn and one on Lawrence, do not accept Medicaid. Therefore, Allegiance Health is providing the urgent care for individuals with Medicaid or without health insurance at the ED department with no copay applied. So they're covering them in that way. Further conversation with the Allegiance Health group, the team, is that there may have been a maybe more comprehensive way to go into this change in healthcare access services, and that to have more of a large stakeholder, diverse group meeting to talk about all the angles and how this will affect the healthcare of our community. And the plan is to, with our health improvement organization, we have the health action teams that focus on nutrition, physical activity, smoke-free life, etc., to have an access for care health team that would be a diverse stakeholders group and look at these issues and to come to some joint follow-up plan as well. So I'm just offering you what we have now as an interim. One other thing that I can, and it is in your report, so I don't want to be redundant here, but our personal and preventive health position, the position that Mary Riccadello retired from, we have posted that position. We have gotten little to no applicants. It is now a master's prepared position. It was not when Mary applied for the position. We had one candidate that was an associate degree RN apply, so really didn't come close to meeting the standards. But we reposted it as a BSN position with allowing up to 3 years to receive their master's in that time frame. And we have now one internal candidate that we are planning to interview within the next week or two. So that is kind of our plan for that.
Thank you, Ms. Bullinger. In regard to the report, there's one area I would like to ask you 2 questions on. State law requirement for EpiPen auto-injectors in public schools.
Yes.
So reading your report here, House Bill 4353 passed the legislature and has been signed into law. When will this take effect is question number one. And number two, what are we doing to share this information and the availability of the services the health department is offering with the county superintendents and school districts, if you're able to answer them?
I am, and I'm not exactly sure when this is to take place. My thought is ASAP. I know that our medical director has offered that he will provide the prescriptions for all the school districts, because otherwise they would have to work and find a provider in their area. And we have already sent out the email. We have several school districts that we've already sent the prescriptions out to. But as far as, I believe then the next step would be for the schools, because it's part of their board policy, then to educate the parents and children in their school that they do have this available. And I think it's wonderful. I think, wow, it's like one of those things we should have been doing for a long, long time. Because as we know, children can have food allergies, medicine allergies, be stung by a bee, and for the anaphylactic shock reaction, this epinephrine is exactly what we need at the schools. So.
Right, thank you. What other questions might you have? Commissioner Rice?
In regards to the position for director that you're trying to fill, how far reaching is that as far as applicants go, as far as the pool?
Yep. We did, in all of the Michigan School of Nursing programs, we've sent our application out to all the universities, or the posting, excuse me. We have posted on through the Nurses Administration Forum, through our MALF organization. And I know we've also placed ads in the Ann Arbor, Lansing, and Jackson newspapers. Yes, yeah.
Any other comments or questions? All right, thank you.
All right, thank you.
Next on the agenda, we have Department on Aging Monthly Report. Ms. Wendell?
Okay, good morning. You have in your information an electronic copy of the 2013 Department on Aging Annual Report. And so this morning I wanted to just bring out some highlights about the annual report. And our services fit with the Commissioner's strategic priorities, primarily with healthy community. We try to, our programs help people be active, have good nutrition, have services in their homes so that they can live independently for as long as possible. And that's the cover of our annual report then that you have. And what I want to do is look at the outcomes that are part of our 2015 budget that was presented on Friday. We have every department has outcomes as part of the budget performance measurements. So I'm going to tie those in with our annual report. So on page 3, at the top, there's a program, Caregiver Support Program, and that's where we have staff who talk with people who are caring for someone who are older, or maybe a grandparent raising a grandchild. And one of our outcomes related to caring for someone who's older, 97% of people that we've served say that they're better able to understand their options for service and access those services as a result of caregiver education and support. And 92% reported a decrease in their level of stress. So having that information, knowing what your options are, what the resources are, can help people make a plan and lower their level of stress for caregiving. The next, further down on that page 3 of the annual report, Medicare Medicaid Assistance Program, MAP, and we've seen an increase between 2012 and 2013 as far as the number of people seen for Medicare Medicaid assistance. And the primary push for that information is when people enroll for their Medicare Part D prescription in the fall. That's where we see quite a bit of clients that have questions. How do I look at the website? How do I pick my best options? And whenever the MAP numbers increase, then our case coordination and support, that's the number below Medicare Medicaid Assistance Program, that usually goes down because our part-time person who does home delivered meal reviews is our MAP coordinator. So we're quick to get out for our initial assessments, because anyone who gets a home delivered meal or home care service, the initial assessment happens within the week. But every 6 months, we're to do reviews, and that's what will usually go down. We don't have time to do both MAP assistance and do reviews, so the reviews might be delayed, is what that means for us. But with case coordination and support, as I mentioned, we do the initial in-home assessment, and that's to talk with the person, what's their situation, what resources do you have, what other family members can help, and connect them with other resources in the community, as well as our services that we have, either home care or Meals on Wheels. And then every 6 months, there's a reassessment. And for case coordination, the outcome is that they indicate they better understand community services that are available, and 99% agree with that. Part of the assessment is talking about, do you need help bathing or dressing? Can you prepare your own meals? Can you ambulate? Those are activities of daily living, or ADLs, and then instrumental activities of daily living are housework, shopping, mobility outside the home. So this is just a statistic to show you the level of need that the people we're seeing have, that on average 3.2 ADLs, they need assistance with an average of 3.2 things in their home, and with other activities at almost 5. So the people we're serving with home care and Meals on Wheels have a need to have assistance with those types of services. Same page 3 on the annual report, looking further down, our Meals on Wheels statistics. And we served on average 883 meals a day last year in 2013. And our outcome, 94% of participants surveyed attribute Meals on Wheels as helping them with proper nutrition, and 98% attributed Meals on Wheels as helping them in their ability to live independently. So having that nutritious meal helps your health, because, again, it is nutritious. And it also helps them when there's a lack of mobility to get out and get the groceries or stand and cook a meal. Further down, again on page 3, home care assistance. That's the routine house cleaning and personal care or bathing assistance. And in a month's time, on average, we provided 1,860 hours of home care assistance last year in 2013. 95% of home care clients surveyed reported that home care assistance they received helped them remain living independently at home. And Alzheimer's respite is respite for families caring for someone with some form of dementia, and the families can choose what kind of respite they prefer, such as adult daycare, where the person goes to another location, or in-home respite during the week, or even on the weekend or overnight, depending on their need. And the hours of service did go up last year because we received additional state funds for Alzheimer's respite last year. And 93% of Alzheimer's respite caregivers reported being better able to cope with caregiving because they received respite. Respite is where someone is with their loved one so the caregiver can leave and do things that they need to have done outside of the home. Then on page 4, counseling services, and primarily this is supportive counseling for people who are homebound. They can't get out and meet with a counselor. And 78% of our participants reported being better able to cope with their life circumstances as a result of counseling. And Gatekeeper, I thought I'd mention. Gatekeeper is when we get a call from maybe a law enforcement entity or a neighbor or Consumers Energy, and also our home care workers or meal drivers will let our social workers know, this person seems confused, we just wonder if they're okay. It's not really an adult protective services referral, but they want someone to talk with the person, see what their situation is. consumers may call us because there's an outstanding bill and they're not sure if the person understands what's happening. Many times when the social worker goes and meets with the person, there is a memory or depression screen. Grief counseling may result because of that connection with our counselor, or maybe the social worker will help the person contact their doctor or family member to talk about their situation. And this is part of our geriatric mental health program. Sorry, getting ahead of myself, so I gave you some examples. And that has increased over time. 2 years ago, it was 64 clients, and last year was 110. Then on page 5 and 6 talks about our senior centers, our active part of our services, and the meals that we've provided. And we have 7 senior nutrition sites, and 2 of those are senior centers. And senior centers have activities such as exercise classes, volunteer tax assistance, AARP, driving safety courses, podiatry clinics. And of the senior center participants surveyed, 98% reported a higher degree of health and life satisfaction as a result of doing things at the senior center. And just an interesting thing we keep track of, 24% of senior center participants attend 2 or more programs. So what that tells me is we have a lot of people that come for one particular program, and that meets their need, that keeps them involved, and that's what they're interested in. So we offer a variety of services so that people may find something that they're interested in, getting out, socializing, again, being active. And a list of our senior nutrition sites, and 40,700 meals last year for 1,066 people. And again, we survey participants, and 79% said that the nutrition and socialization helps them remain living independently. That's what our mission is. And 94% attributed congregate meals as helping them with, again, proper nutrition, part of the health component. So are there any questions about the performance outcomes or our annual report?
Any questions, comments regarding the report? Marcy, it never ceases to amaze me as long as I've sat on a Human Services Board, how many services we provide for our community within your department. How well do you collaborate with 211 in making sure that the general public is aware of these services provided?
We are quite close to keep 211 informed. Quite often, if it's a situation where it's a caregiver for someone over age 60 or anyone over age 60, they will refer them to us. So they may give them a general description of what options there are, but they refer them to us so that our staff can give them more details about how are you eligible, what kind of information do we need. So, and we refer people to 211 as well.
Excellent, thank you. All right, seeing no other questions or comments.
Okay, thank you.
Thank you. Next on the agenda, we have Lifeway's monthly report.
Good morning, Commissioners. Okay, in your packet, you will find this month's report. I'll highlight a few things in the report. First thing on the first page, to give the County Commissioners an update related to the building. We had anticipated that we would be closing on the building by June 15th. There has been a change of plan. We have now currently requested an extension. The current purchaser is still pursuing financing, and we had received an update on Friday that still is moving forward. So as soon as I am aware of actual final confirmation related to financing, I will keep the county informed. The other thing on your packet is related to access to services. I included information in your packet this month. I thought that the county would like to know as it relates to how many people are coming to Lifeways to receive services, and this number is not inclusive of all people. The number that you see on that first page are for a total of 2,093 since January through the end of April. is individuals that actually come in for crisis services. So there are roughly 200 people per month that we see that are just a matter of connecting. Maybe they need to utilize food banks, or we connect them with 211. So a lot of it is connecting with other resources within the community. But I wanted to share with you what that looks like. And then on the back of on page 2 there, gives you a breakdown related to diversion, because diversion allows us to be able to reduce costs, especially reduce costs related to our general fund population. And you'll see here the rate of individuals that we are able to divert, and of those that come in for service for an intake, how many of them actually end up receiving services at Lifeway. So there's a breakdown there kind of demonstrating that over per month. The other thing important that I'd like to share is I know that it's been challenging, at least since I've been in this position, related to access and feedback from the community about how to access services. And one of the things that we've implemented this year was to survey all people coming in through our access center. And you'll see here that we were able to access 274 individuals that have come in, and then surveyed them to find out, did you get what you thought you were going to get? Did we connect you? Did you follow through? Were you satisfied? And there is positive things in here related to people being, comments made about being satisfied with services and feeling like they got what they needed. The other thing was that there are 2 areas that were identified related to wait time and to individuals requesting job assistance. So these are things within our organization that we're going to be addressing. But I wanted to share with the county related to what are we hearing related to those that actually come in trying to seek services. The other thing that's in your packet is related to general fund. As you know, that's April 1st, we received a 55% reduction in funding, and we had to implement some strategies to address and manage the reduction in funds. In January of this year, just to kind of give you a sense, we had 850 individuals that we were receiving utilizing general fund dollars. And what's important is for people to note is general fund is not an insurance. So we utilize those dollars to serve the uninsured that come to our door. And with the reduction, we did have to implement things like a waiting list. We did have to look at criteria that we screen individuals for utilizing services. And at this point in time, we are down to 198 individuals who are receiving services being paid for out of general fund. What we've done with those individuals, the difference between the 850 and the 198 is worked with community providers to transition. Many of them were able to be transitioned to their primary care physician for the ongoing medication. The other thing that we've done is we've really assisted with the Healthy Michigan enrollment. As you know, I don't know if you've seen the numbers, but for Jackson County, we're at 66% related to the number of individuals that are enrolled in Healthy Michigan compared to what they had projected. So that's a good thing. You had a question?
When you get someone that walks in the front door that is not insured, and they don't qualify for Healthy Michigan, do you move them also through the process at Center for Family Health to get them to get for-pay insurance?
We'll do two things. They come in and they do not have insurance and they don't meet eligibility. Whether they meet eligibility or don't meet eligibility, we immediately assist them with applying for Healthy Michigan, because a good majority of them coming through our doors will meet that eligibility for Healthy Michigan. So we assist with that process. The other thing that we do is we do look at what other resources in the community can help them, and Center for Family Health is one in which we refer them to.
I would imagine having Center for Family Health right there in your own facilities is extremely beneficial.
Yes, it is. It has been. There was a challenge there for a period of time where they had lost the nurse practitioner that was on site, and so I want to say it was a couple of weeks actually where they were closed there at Lifeway's site until they had found another nurse practitioner. Now they have a nurse practitioner who actually specializes in behavioral health, so that is actually quite a benefit for us.
Because it's
Yes.
not convenient whatsoever to have these individuals tell them to go 5 miles up the road to another physical location, as long as you've
No.
got them in the building.
When they are in the building, we will literally walk them to the back to ensure that they make that coordination and that contact with the Center for Family Health.
Do you see, the number you gave was 198 individuals using the general fund dollars. Do you see that number decreasing? Or maintaining?
Unfortunately, this is where we're challenged, and I've talked about the fact that there's populations of individuals who will not be eligible for Healthy Michigan, and we're at the point now where this is about as low. It might go a little bit lower, but a lot of these people are individuals that have Medicare and Medicaid who will not be eligible for Healthy Michigan. It's also individuals that are on a spend down, and some of them quite extensively high spend downs that will still, and they're receiving specialized mental health services, and they have to continue for their health benefits. So they will remain within this group.
Commissioner Shotwell?
Would you explain to the commission the definition of general fund dollars?
Okay, general fund dollars are dollars that we receive from the state of Michigan, from their general fund, that are used for the community mental health to be able to serve those individuals in our communities who are uninsured. But they have to meet specialty mental health services, meaning they have to be severely, persistently mentally ill in order for us to serve them. It is not. No, it is this. It's a different revenue stream.
Thank you.
Yep.
If you want to carry on. Thank you
Okay.
for answering our questions. as
Hey,
you
no
move forward.
problem, I'm fine with that. The other thing that I wanted to mention was just that you'll see some charts in here that a lot of it probably maybe is more detail than you need, but what the gist of the charts tells you is that it looks at our projection of fiscal year spending 2013, and then looking at year-to-date, where are we related to the expenses with general fund, and then projecting that out, will we be underspent, so that we will remain, because we've received a 55% reduction, we need to be sure that we're below what we're going to be funded. And based on estimates at this point in time and projecting that out, we will be under, which is both a good thing from a financial management perspective, but a bad thing from the perspective of that means that there are individuals who are not being served because we don't have the funds to do that. And that is it for my report, unless there's additional questions.
Comments or questions for Mary Beth? All right, thank you for that
All
report.
right, thank you.
Next on the agenda, Mr. Wellahan, Veterans Affairs. Veterans Affairs has surely been in the news quite.
Not my part of
Extensively.
it, thank you.
Thank you.
Yeah, you're welcome. That's an unfortunate thing that's going on right now in the VA, but I don't believe all of it. I know our system in Ann Arbor is second to none, and I've asked the questions to people that use the Ann Arbor facility, and so far I've not had anybody refer to an incident that would even reflect what's been going on in the news. So I'm pretty happy with the system in Ann Arbor, so I don't worry about that too much. A couple of things that I wanted to just point out from what I sent to you was all this information that we have here as far as the income that shows from the VA, that comes out in what's called a geographic distribution report. They refer to it as GDX. It comes out every year in the first half of May. So these numbers are fresh and it's pretty good info for me. The report shows every state, every county. It's broken down. It's a huge report, as you can imagine. And it shows each line item of the things that I've mentioned in this report. And just to kind of highlight on things, these are on the report itself, it says at the top in 000s, which means even though it's showing $29,000 on the report, it's referring to $29 million, okay? And that's exactly what we had this year for last year. This is all based off of 2013, $29,701,000 that came back into the pockets. Those are compensation and pension payments that were actually made by check or direct deposit to the veterans or their family members that qualify for these programs. So, it's pretty significant when you stop and think that hopefully we're helping these families survive and make a better life for themselves, because all know that times are pretty tough out there. If you look at the graph that I sent along with this, you notice last year there was a pretty significant drop in the total income, and that's because the VA did an adjustment. Before 2012, everything was based off from, I guess if you would want to say it, guesstimates. It was an estimated number. What they projected according to budgetary numbers, they kind of estimated on where we actually ended up. In 2012, the VA took these numbers out of what actually was spent from their budgetary numbers. So that's a true number starting in 2012, and then again this year. For 2013, the referral there is an actual true number what was budgeted. Now, obviously, other counties are going to have higher numbers than we are, because you take Macomb County with 108,000 veterans, or Wayne County with 120-some thousand veterans, and Macomb, Wayne, Oakland, Kent County, all those counties are over 100,000 veterans. So their numbers are going to be way out there compared to what we would show here. But when I broke it down, we're 13th for population in the state, which I think pretty much flows with the way Jackson County is for population and all those demographic figures that they use. But when it comes to the dollars returned and then the total dollars returned, we were 10th for dollars returned for compensation and pension, and 9th for total overall numbers. So those are just kind of feather in our cap in our office, I guess, because it shows you what kind of work we do to help these veterans. A couple of things that I didn't have in the report that I found out since was on July 21st, the VA is going to push a big homeless program, more or less a stand down, if you will, here in Jackson. They're in cooperation with the Community Action Agency and TTI, Technical Training Institute, I think it stands for. They both received a grant of federal money through the VA that equaled about $5 million that was spread out amongst some other organizations as well, to help veterans with homeless problems, monetary problems for making house payments, keep them from becoming homeless. And the push that we're going to do in July is looking for those veterans that are living in the tent in mom and dad's backyard or living on a couch at mom and dad's house that truly are homeless, but they're not homeless. VA considers somebody living on a couch at mom and dad's house to be couch homeless. Technically, they are homeless for VA purposes. And so we're going to try and see if we can find some of those folks and get them into some of the VA programs. They may not be using the VA healthcare. They may not have come in and applied for benefits because they're combat vets from Iraq or Afghanistan. And so we're going to reach out to them and try to get these people involved with some of the programs that we have. And the VA is going to partner with Community Action Agency and a group called HALO. Now, HALO doesn't get the grant money, but they have some pretty good inside track information on where these people may be. So we're going to use them a little bit too to help try and locate and identify some of these veterans. One of the problems that we found is you've got a young veteran that's been drinking too much or something because of what he's been going through, and his parents don't want him in the house. So they said, you can stay here, but you're going to sleep above the garage in the apartment or in a tent in the backyard or whatever you want to do. So that's the one that they're going to try and target, that type of veteran. So far this year, we've averaged 167 clients each month. We figure that about a third of those are new clients for the office, and the other 2/3 are just people doing follow-up. We ask them to sign in every time we come in. We probably get 3 to 4% that don't sign in. So these are kind of a roundabout number. But that's what we've got going on so far. I don't really have a whole lot new to report to you. Probably in December we'll have a little more on our partnerships and that sort of thing that we have. A couple of them are starting to falter a little bit, so we're trying to rebuild the connection there. But so far, so good. We still have 3 service officers coming into the office, one every Monday, every Tuesday, and every Wednesday. And myself, I'm also a certified service officer, so we figure there's 3.5, because I don't do as much work on the claims as those guys do, because I do so many of the other things there. Now, the way we do it is to take the pressure off of them so they can concentrate on the pension claims for non-service connected disability and for the claims for service connection, for compensation for the veterans, is that I do all the healthcare enrollments and I do all the community stuff when somebody comes in and asks a question about where do I get this help or that help. And quite often, while Marcy was speaking, it happened to dawn on me, we refer a lot of folks to them as they refer a lot of folks to us, so there's another tie-in within the organization that we help each other some too, so.
Great. Thank you for that report. What comments or questions might you have for Mr. Wellahan?
Come on, somebody make it tough. Well, that was great. Thank you.
Dina, thank you for that report. Next on the agenda, Medical Care Facility Quarterly Report.
Good morning, Commissioners. I won't belabor you with reading every line, but I would like to give you the updates that have occurred since this report was written. Under finance, when I refer to the 51,000 Medicaid days, and I talked about we struggled with census from the beginning of the year, I just wanted to also add that the hospital census, from my understanding of our portal system, has been down somewhat also, so they too have been struggling. Skip down to service, and where it talks about the presentation to the Best Practices Conference. I did not include what that was, and that was on addiction in geriatrics, and it piggybacked on PTSD in our aging veterans. Also, we are working with our regional emergency planning organizations at state and regional levels, and we're going to be involved in a mass fatality regional drill later this week. And Janine, our assistant administrator, is going to be heading that up. Under quality, we just completed on Friday our annual survey, but we don't have the results yet. So we're waiting those, and it usually takes about 10 days or so for that to come. We also reviewed statistics comparing our outcomes, and this is our clinical and our operational outcomes to state and national averages, and we scored better on some extremely important fronts. One is on the use of antipsychotic medications. We're significantly lower than both state and national averages for our population. The same with pressure ulcer development, staff turnover, and hospital readmissions, which is extremely large on both hospital and long-term care plates. With the Affordable Care Act, we're required to have a hospital return rate less than 16%. The last 3 months, we've run between 0 and 6%. So we're doing very well. And that means that we're managing those high acuity cases much better than the average nursing home. We did send the report that was requested from the study group electronically to Delane this morning for your review. And if you have any questions?
What questions or comments might you have for Sandy? All right. They're pretty quiet today.
Well, they all know where to find me.
All right, thank you for that
Thank
information.
you so much.
Next on the agenda is our amended item, Ms. DHS. Thank you. And so I did prepare a typed sheet that I have sent out to all of you, as well as Carrie Ann for public record. Thank you. Welcome.
Thank you. Good morning, Commissioners. Because you didn't get this until today, I will just briefly go over it for you and then answer any questions that you have as well. As I discussed at our last quarterly meeting, Jackson DHS and Hillsdale County DHS are now a dual configuration, so I am the director over both counties at this time. So I've spent the last quarter sort of getting to know the services and where they overlap for the two counties, and then where they are very distinct and separate. So that's been of some interest. I've found some areas in which I didn't know that they overlapped, and it will help us, I think, form some strong bonds. And then, again, some of the areas that we are separate continue to be sort of our medical care providers, our courts, and then our county governments. In April, the Affordable Care Act went into full swing, and we had all of the applications coming in. Folks could go into our DHS offices, some of our community partners' sites. They could apply online or by telephone. We did pretty well. I think we were prepared for lines to be out the door and down the street, and we didn't have that in any of our offices around the state. But we did have a regular sort of number of folks coming in each day to apply. Jackson at 66% did pretty well. I think Hillsdale was a little bit less, at about 30% of the population. So we're still urging folks to come in and apply. There are approximately 100,000 cases where people applied online that have been approved, and they are sitting up in the federal portal. They will be released down to the DHS offices for the state of Michigan sometime in the near future. We don't know quite yet when, and those will then go to our staff. So Jackson will get a portion of that number. And then there are also about another 100,000 cases that were denied at that level, but they will also be sent down to us so that we can relook at them and investigate them and find out if those folks will be available for some other type of Medicaid or other type of service. And again, we're not sure yet when those will be coming to us, but we think sometime in the next 30 days. In Children's Services, over the last quarter, we met with the court regarding the expenditures in Child Care Fund. When I came into Jackson in February, there was some concern about us not being able to make all of our payments with the amount that we had received. And we requested an amendment of $1 million in order to make the payments for the foster care children in residential and foster care placement. That was approved, and all of the signatures have been completed at this time. Today, I'm meeting with a stakeholders group at the court that includes judges and other court administrators, and we are looking at, one of the things on the agenda is to discuss the potential for some federal funding for some of our children, our youth, who are delinquent and go into a residential placement. There is potential for federal funding for some of those children that has not occurred here in Jackson. And so if we can even find that one or two of these children might be approved for federal funding, those are our most expensive placements, and that can actually save the county some money. So we've been in talks with Ingham County and some other counties where they've been successful, and so we're going to present some of that information today and see what we can look at for that.
Do you feel confident? Is there a strong likelihood? I'm guessing, Zoe, that this is something you have experience with and are bringing this to the table to offer new information solutions.
Actually, I think a couple of us had the information at the same time. Charles Adkins talked about it, but since I had come from Ingham, I was aware of it, so I made some contacts with my people there and was able to get some information. Finding someone federally available for federal funds is a bit more difficult. They have to have certain deprivation factors. So a youth who might be looking at a residential placement has to have only one parent, potentially, a disabled parent, or has to be at an extremely low income level. But is that possible? Absolutely. And, you know, it can cost, for a residential placement for a delinquent youth, can be $100,000 for a child for a year. So if we even find one, that's significant. And if if there's a couple that we can find the federal funding for, then yes, I think that this is something definitely worth looking into. So. We continue to work with the prosecutor's office on success toward the Child Advocacy Center in Jackson, and our school justice partnership, keeping children in school so that they find success and do not end up as delinquent youth as they get older. And also, we are just starting to work on a vulnerable adult protocol. There's been a lot of work on children and vulnerable children, so we're sort of moving toward looking more at our vulnerable adults. And that's sort of my update for the last quarter. Any questions?
Thank you. What comments or questions might you have for Ms. Lunds? All right, thank you for that information, and good luck this afternoon.
Okay.
Oh, yes. Commissioner Leitner.
I just want to say thank you for taking care of the issue that I had with a constituent last week. I appreciate your reply quickly and
Yes.
swiftly, so thank you.
You're welcome. Thank you.
Thank you. Next on the agenda, we have the Lifeways funding issue and document. Does our administrator, controller have any comments regarding this issue?
I'd be happy to answer any questions. I think probably all the information has been distributed and is available.
So we're looking for a motion to approve the attached settlement offer with the Michigan Department of Community Health and move forward to the full board for further consideration, is my understanding. We have a motion in support. Any comments, questions, concerns? All in favor say aye. Aye. Opposed? All right, this will move forward unanimously to the full board. We have the claims from May. We have a motion in support to pay the claims from May of 2014. All in favor say aye. Opposed? Motion passed unanimously. In your board doc packets, under other minutes, we do have the DHS board meeting minutes from April. July reporting schedule, Department on Aging, Health Department, Lifeways, Animal Shelter, Community Action Agency. We have now arrived at the second public comment. Are there any public that would like to speak for 3 minutes or less? Seeing none, are there any committee member comments or commissioner comments? Seeing none, we'll adjourn to the call of the chair.